There's so much going on all around you, and if you don't look out, it'll knock you over. On some days, it feels like I'm completely underwater. If you're seeing 20 patients in a day, it becomes very challenging to keep up with the breadth of disease that's coming through your doors. My name is James Hamrick. I'm a general community medical oncologist. I've been fortunate during my career to witness a huge explosion of innovation in cancer care. At the very beginning of my career, we didn't have as many treatment options as we have now. So chemotherapy was still a fairly blunt instrument. Some of the older generation chemotherapies were like going after a cockroach with a sledgehammer. You know, you might get the cockroach and that's good, but you're gonna tear your kitchen up a little bit. We used to think about cancer in a very simplified way, but we think about it totally differently. Now we understand cancer is thousands of diseases, and that's great because it allows us to treat each of those in a better way for that specific cancer. The pace of innovation is wonderful. The past couple of years, there have been over 40 new medications approved by the FDA for different cancer scenarios. But it's a bit of an avalanche for cancer doctors. It's extremely challenging for clinicians to have all of the information they need to help their patient make the best treatment decision. The way that we have built these systems to support clinicians has been fairly disorganized. It's not uncommon to live in a hybrid world of both paper and digital technology. Healthcare is the industry that's keeping the fax machine alive. If you're seeing 20 patients in a day, we have to make the best use of that time. I can't spend that time printing things out and reading documents and sorting through faxes because my job is really to listen.
So this is a lot of information.
Technology has to play a role here. Those are great questions. In 2016, I joined Flatiron Health. I lead the clinical oncology team. Flatiron is a health tech company that provides software and solutions for doctors in the exam room and provides data for good for researchers, regulators, and investigators. We work with a lot of oncologists across the country, and one of the consistent themes that we heard coming back was, it's getting more complex. In order to make sure that I have all the information and I'm not missing an opportunity for a better therapy, I would like a tool that helps to surface the latest and greatest treatments for me. But it can't slow me down. We started building a tool that would do that and would allow physicians to be sure that all of the latest FDA-approved therapies and all the latest science was available to them. So Flatiron Assist is very physician-friendly. What Assist does is it's built right into the electronic medical record, which is where all of this is happening, whether it's capturing the patient's story, ordering the therapy, it's layered right in at the appropriate place. So as I go through, choices are surfaced to me. Clinicians need an assist to make sure that they're not missing an opportunity for a better outcome. Like many people, technology has transformed the way I live my life. In some ways that's for better, in some ways that's probably debatable. It's fascinating to me the way that technology gives us access to vast amounts of information. And it's amazing to see how it's transformed everyday experiences for people and really made life different in many ways and enriched it in many ways. We're just beginning to be at the point where we can really unlock the potential of having this data digitized. I work for a health tech company that uses data for good. It's all about the patient. When you're dealing with cancer, this is the biggest day of their lives. We expect this to be a very good outcome. I wanted to be able to make the experience in the exam room better, and I wanted us to be able to learn from the experience of every patient that came through. And that's incredibly empowering for me as a doctor.